distinguished guests, faculty and staff, students, ladies and gentlemen. Good morning and good evening. My name is Winnie. It is my privilege to welcome you all to join us today for Academic Forum Series 7, learning about health in times of the pandemic as we celebrate the 30th anniversary of the founding of LiPACE School of Professional and Continuing Education, Hong Kong Metropolitan University. Thank you for coming, and a very warm welcome to you all from Hong Kong Metropolitan University. For today's academic forum, we are honored to have invited two prominent international guest speakers from the United States and Malaysia, who will be sharing with us the global One Health movement and role of digital health literacy to public health during COVID-19. Thank you for being with us today, and a very warm welcome to you all. Before the forum officially begins, I would like to invite our President of Hong Kong Metropolitan University, Professor Paul Lam Kwan Sing, to deliver his opening address. Professor Lam, please.
Thank you, Winnie. Dr. Deborah Thompson, Dr. Roy Valera Martel, Dr. Benjamin Chan, guests and participants. Welcome to Academic Forum Series 7, Learning about Health in Times of the Pandemic. Please allow me to give my sincere thanks on behalf of Hong Kong Metropolitan University to our honorable speakers for your generosity of time and valued sharing. This is the 7th Academic Forum of the LiPACE School of Professional and Continuing Education, LiPACE, to commemorate the school's 30th anniversary in 2022. LiPACE, one of the 7 schools of Hong Kong Metropolitan University, has always strived to provide quality vocational and professional education at the post-secondary level. It performs a complementary and vital role in fulfilling the university's founding mission of providing education for all, as evidenced by the extensive range of disciplines and subjects covered in its program offerings. LiPACE is now an established vocational professional education and training provider of full-time post-secondary education and part-time professional and continuing education programs, as well as corporate training courses. At the same time, the school is advancing non-formal learning through its 2 flagship programs for women and senior learners, namely the Capacity Building Mileage Program and the Elder Academy at Hong Kong Metropolitan University, respectively. I'm particularly delighted to inform everyone that these 2 flagship programs have been further boosted by new funding from the Hong Kong government. The COVID-19 pandemic had a great impact on the public's understanding of health issues and infectious disease prevention. For educators, the teaching of health education and health promotion will no longer be the same, as new ways of effective communication of health messages and client interaction models have been adopted. At the same time, there has been renewed interest in how the climate crisis is interlinked with the spread of diseases from animals to humans. The concept of One Health emphasizes the interconnectedness of humans, animals, and the environment, providing a broader framework for the study of health, and it also connects well with the objectives of UN Sustainable Development Goals of 2030. In this forum, we are honored to have distinguished speakers from around the world who are passionate activists of new methods of public health education and the One Health movement. We look forward to listening to the presentations of our distinguished speakers, whose insights will help us reform our concept of health from an international perspective. Most importantly, together we will explore the role of One Health and the way forward to using digital communications in various aspects of community health in the future. The signing of the MOU is the first step in our collaboration, which will certainly lead to many new joint initiatives between both sides in the future. Lastly, I would like to extend my thanks to our LiPACE staff who are involved in organizing this forum. I wish the forum great success, and I hope all the participants have a rewarding and fruitful exchange of ideas. Thank you very much.
Thank you, Professor Lam. It is our honor to have you with us today. May I now invite Professor Lam to present plaques of appreciation to our speakers for their generous support to our forum. First, may I invite Professor Lam to present an appreciation plaque to Dr. Deborah Thompson from One Health Lessons.
I hope I can do it in person one day.
It's a pleasure. Thank you very much.
Thank you. Thank you for your participation.
Next, may Professor Lam please present an appreciation plaque to Dr. Roy Rilara Mazo from Management and Science University, Malaysia.
Same invitation to you. I hope I can.
Thank you so much for this
in Hong Kong.
opportunity.
Okay.
Thank you.
Let's take a virtual group photo to mark this memorable event. Thank everyone. On behalf of the school, we are honored to have established collaborations with the institutions of our speakers, such as to develop a general education course in promoting the One Health concept to our students and the young generations with One Health lessons, and to have virtual teaching exchanges, research collaborations, program articulations with Management and Science University. May I invite all of you to witness this virtual signing ceremony of Memorandum of Understanding between One Health Lessons and HKMU LiPACE, as well as Management and Science University and HKMU LiPACE. May I now invite Professor Lam and our Dean of the LiPACE, Dr. Benjamin Chen Tak-Yun, and Dr. Deborah Thompson to join us and take a photo to register this moment. Thank you, Dr. Thompson. Would Professor Lam and Dr. Chen please stay? May I now invite Dr. Roy Rilara Mazo to join us and take a photo, please. Thank you all. We look forward to our close collaborations in the coming future and hope that we will all benefit from this unique opportunity. Now, without further ado, let's welcome our first speaker of today's forum. Dr. Deborah Thompson is the chair of the World Veterinary Association's One Health Education Subgroup. In addition, she founded an organization that inspires children and adults around the world to value the interconnection between human health and the health of the environment, plants, and animals, called One Health Lessons. She has served as a science policy advisor in the United States Congress and is also a clinical veterinarian and award-winning public speaker. Dr. Deborah Thompson is also the author of The Art of Science Communication. Her articles have been printed in multiple publications, including The Lancet Planetary Health. The topic of today is the Global One Health Movement. Welcome, Dr. Deborah Thompson.
Thank you very much for the kind introduction. And thank you very much, Professor Lam, and everybody else on your team for the kind invitation to be here, joining you from the exact opposite side of this planet. So have a happy and good afternoon to everybody. I'm calling in, it's the evening from the day before for me. Well, let's get started and discuss this global One Health movement, because it certainly is important for everybody on this planet, regardless of where you are found today. And I'm calling in from Washington, D.C. in the United States. The first thing I wanted to discuss is really, what is One Health? What is One Health? It's a big question. We can explain it in two different ways, simply. It's a concept and it's an approach. The concept is best described as that connection between our health and the health of the environment, animals, and plants. Sick environment means sick people. Sick environment means sick animals, means sick people. So we're all connected. And that's really important to keep in mind and have that One Health mindset going forward. Now, the next step, and keep in mind when it comes to our health, it doesn't matter where you are on this planet, right? It's taking care of our parents' health, our children's health, our own health. And this is how it's explained with the One Health high-level expert panel associated with quadripartite, which is a group of 4 organizations: the World Health Organization, the OIE, which is like the World Health Organization, but for animals, the FAO, the Food and Agriculture Organization, and the UNEP, the United Nations Environmental Program. And this is their image, their infographic that goes along with the One Health concept. Now let's move on to the One Health approach. What would that mean? The One Health approach, put simply, it is teamwork between people of different backgrounds, disciplines, strengths. We come together to prevent and solve health problems. So the One Health concept is that connection between everything, right? The One Health approach is teamwork, because certainly a physician alone, a veterinarian alone, an ecologist alone, an economist alone, a sociologist alone cannot handle and prevent such drastic health problems like a pandemic, right? It takes that teamwork. And going back to that One Health high-level expert panel, this is an infographic that explains that. Now, moving on, Professor Lamb mentioned the Sustainable Development Goals with the United Nations. Now, I wanted to write UN Sustainable Development Goals here, but it just looked like unsustainable, so I did not want to do that. But my question to you is, now that you know what One Health is, that connection and that approach with teamwork, where does One Health fit in here in the 17 Sustainable Development Goals? Well, this is where I see One Health fitting in. Does anything surprise you there? It shouldn't. It was all covered, all 17. And remember, number 17, partnerships for the goals. That is One Health approach. And taking the One Health approach, you can handle all of these 16 other Sustainable Development Goals. And that's today, and that's the future. One Health is here to stay. So One Health Lessons is an organization that I created back in 2020. And you can go to onehealthlessons.com to explore what's available there. But just giving you a bit of a background, the mission of this organization is to inspire children and adults around the world to value One Health. The vision is to change societies around the world to create a more sustainable planet. I understand it's a big goal, but through the One Health approach, through teamwork, regardless of where you are on this planet, regardless of your discipline, your strength, your background, we can all work together to create a more sustainable planet. And I certainly did not build One Health Lessons by myself. It took a lot of motivated individuals from around the world, volunteers who work with translations, and I'll talk about that later on, but also the intern team. As of right now, we have had over 40 interns from around the world. And for your interest, the next class of interns, they'll have the application available and up online within the next month. So be sure to follow One Health Lessons online on all the social media platforms. But this is the internal structure of One Health Lessons in order to inspire children and adults around the world to value One Health. You see, I would be in this orange box here as president, CEO, but then we have people, say with the regional promotions interns, we have somebody covering all of Asia and Oceania. We have somebody covering Northern Africa, somebody in Southern Africa, somebody in Europe, the UK, all of the Americas, and it goes on and on and on. Now, again, if you're interested in being a part of the internal team at One Health Lessons, just go to onehealthlessons.com and you'll find more information in the Get Involved section. But what I really wanted to discuss with you is how can you join the global movement that's happening right now with One Health Lessons and beyond? Well, the first thing that you can do is improve your One Health communication skills. What do I mean by that? Well, when it comes to the One Health approach, everybody's coming to prevent and solve health problems, and we're coming at it from different disciplines, strengths, backgrounds. But we need to be able to communicate amongst those backgrounds, right? We're all so comfortable speaking with other people in our own niche field. I'm a veterinarian. I'm very comfortable speaking with other veterinarians. Dr. Marzo is a physician. He's very comfortable, I assume, speaking with fellow physicians, right? It just makes sense. But how can Dr. Marzo and myself speak with each other and speak the same language? That's where the One Health communication skills comes in. So the Lesson Leaders program is a train the trainer program. It's meant to improve your science communication skills and at the same time send out the message of One Health to the general public in your community and beyond. You see, it just takes 4 steps. 4 steps to become a certified lesson leader. And these are for all volunteers who are at least 18 years old or older. The first step is to attend an online 1-hour orientation session. This session teaches you how to speak with a 6-year-old versus a 16-year-old versus a 60-year-old. Very different communication techniques. The second step is to watch an entire lesson be taught online. It was recorded, and you have to pass a quiz at 100%. Now that quiz asks questions about teaching techniques, communication techniques. As long as you pass that quiz, then you advance to the third step. And that third step is to watch a live lesson in real time, virtually or in person. And you'll see what it's like to communicate with, say, 8-year-olds about One Health. Communicate with 6-year-olds about the pandemic, about vaccines. And you'll see how the kids can eventually learn and become interested in such an important topic. Lastly, step 4, you actually teach the lesson, but you don't do it alone. You have somebody to help you if needed. And at this point, you become a certified lesson leader with One Health Lessons. And this is the location of certified lesson leaders as of November of last year. You can only imagine how many more little red dots there are now on this global picture. But you see, it doesn't stop there. Sure, if you're a certified lesson leader, your communication skills are stronger, your leadership skills are stronger, your networking skills are stronger. But if you really, really, really want to make a difference in your community, the best way to do that is share your knowledge. So I did not create One Health Lessons for the English-speaking world. I created One Health Lessons for the world. And I am grateful to the hundreds of people around the world who are volunteering to translate these lessons. Now, certainly we need more people to translate these lessons into traditional Chinese, for instance, in the writing format, and teach in Cantonese. That will come later in the presentation. But the whole point is to bring these lessons home, to meet the children, to meet the adults in the communities. And then if you teach 5 times in your own community, in your own first language, wherever you are on this planet, then you become a One Health Lessons ambassador. With the ambassador status, you then teach others in your community how to teach these lessons. So that's the train the trainer part. Eventually you become a trainer. And can you imagine that influence that you would have in your community? I wanted to share with you a very special 1-minute video. I hope you enjoy it. Well, truly, COVID-19 has affected many, many, many lives on this planet, right? And what's the best cure for fear? It's education. It's education. And by creating a platform in your own community to improve public health education, that can go very far. So how do you become a certified lesson leader? How do you become an ambassador? Take a screenshot here. Visit Get Involved section of onehealthlessons.com and you'll have the information. Now, how do you become a volunteer translator? Take a screenshot here, email this person and express your interest in translating the lessons into whatever language you feel most comfortable translating it into. Now, how do you join the global movement outside of One Health Lessons? Well, the very first step you can do is to subscribe to the YouTube channel, Twitter, Instagram, LinkedIn, Facebook pages associated with One Health Lessons, and you can be well informed that way. Also, the One Health Commission has a newsletter. If you go to onehealthcommission.org, you'll find more information about that. And that keeps you quite up to date on a lot of progress in the One Health space each month. As you can see, you can translate a lesson and truly make a difference in the communities that read and write in the language that you are translating into. Become a certified lesson leader. Practice your public speaking skills, your leadership skills, and keep in mind, you don't only serve as a One Health representative, you serve as a representative of all STEM, science, technology, engineering, mathematics. And think to yourself, with your career, how old were you when you first realized you wanted to do what you are doing today as an adult? Chances are it's probably before you were 13 years old. So how could you serve as a role model for the next generation of STEM leaders? One Health Lessons Ambassador. Practice your One Health communication skills. Participate in some really wonderful events. One Health Awareness Month is every January. One Health Day is November 3rd each year. Earth Day is right around the corner, April 22nd. World Rabies Day, and more. So if you think, okay, well, I'd like to participate, but I don't know how to get involved in local schools. Well, chances are you went to a secondary school, you went to a primary school. Contact your previous teacher, see if you could be a guest speaker there. You can also connect the regional promotions intern through One Health Lessons, through the social media with your previous schools. And you can, of course, become an intern. There's an application process. And again, on social media, we are going to be advertising that throughout our social media platforms in the upcoming weeks. So feel free to take a screenshot of this. I'll give you a few seconds. And I wanted to leave you with one of my favorite quotes. This is from Karen Nyberg. She's a NASA astronaut. And she says here, every single part of the Earth reacts with every other part. It's one thing. It's one thing. Do you think that her background is in ecology? Do you think she's a veterinarian? She's talking about animal conservation after all. What do you think her background is? She actually is a mechanical engineer. Now, why would a mechanical engineer say something like this? Every single part of the earth reacts with every other part. It's one thing. My thought is that she looks out at our gorgeous planet and she sees this very fine line that protects us all. So it doesn't matter where you are on this gorgeous planet of ours. It doesn't matter what your background is. Really, what matters is how you see your actions today and how you can impact the future in order to create a more sustainable planet and work towards the United Nations Sustainable Development Goals. It is an absolute pleasure to partner with the Hong Kong Metropolitan University. And on behalf of One Health Lessons, I thank you very much for this opportunity to speak and to share our story and our message. Looking forward to the collaboration in the next year and beyond. Thank you all very much for your attention.
Thank you, Dr. Thompson. So we understand that the importance of teamwork in association with One Health and sustainable development. Actually, all of us should have to play a part in this. So it is now open to the floor for the question and answer session. Should you have any questions, you might type in the chat box or unmute your microphone to ask your questions. So I received a question, and it's about the use of antibiotics in animal or aquatic farming, like the crabs. What would be the impact on One Health, and how should we face the challenge from individuals' perspectives as well as from the government policy?
Such an important question. And actually just yesterday, I had an article published about this, and particularly antimicrobial resistance and One Health education at the undergraduate level. So you mentioned in aquaculture with fish and marine wildlife and such, and also coming from the farmlands, right? There are a lot of sources of antibiotics and antimicrobials, so antifungals as well, in our environment, in our waterways. It can come from farms for sure. It can also come from pharmaceuticals and human medicine. So the thing is, just one sector can't handle this by itself. We have to include soil scientists. We have to include water analysts and water scientists. We have to include economists, because as a science policy advisor at a federal level in the United States, I know very well from experience that policymakers need to understand the economic importance of such health risks. Antimicrobial resistance is certainly a massive health risk that's not discussed nearly enough across the world. But in order to make our message stronger from the veterinary perspective, from the human health side perspective, from the pharmaceutical perspective, wherever you're coming from, we absolutely need to include in the conversation, before we approach policymakers, the economists and the other social scientists. Because policymakers need to have a good understanding of not only what are the problems, but what are the solutions. And that's actually what I write about. Do I have my book with me? Yeah, I actually do have my book with me. That's what I write about in my book, The Art of Science Communication, sharing knowledge with students, the public, and policymakers. A whole last third of this book is about how to communicate with policymakers. So it truly takes a team to get the right angle for the right audience. Hopefully that's been helpful. Feel free to connect further with me on LinkedIn and we can further the conversation. Thank you.
Yes, in particular, during this COVID-19, the issue will bring the concerns for the One Health and the awareness to the whole community and the society. Yeah. And as mentioned, that the sustainability becomes more important, in particular the response to the climate changes as well. So are there any new initiatives or direction for One Health with relate to the sustainable development in the future?
Good question. There's a lot of movement in the One Health space, a lot of movement. Just a week and a half ago, I was speaking at the World Veterinary Association's Congress about exactly this. I said, you know, in 2022, I'm saying this, but in 2023 might be a very different conversation. There's a lot of movement. In preparation for that particular talk, I reviewed over 12 country One Health frameworks, strategic plans, but I know for a fact that there's 5 additional countries that are working on their own strategic plan right now. In short, there's a lot of movement. And what I really appreciate is with the Hong Kong Metropolitan University taking a lead in the One Health space, that means that they will be the point people to help policymakers locally and in the whole region of the world, because certainly expertise is important, but also having those strong communication skills and incorporating the right people in the mix in order to educate not only the public, but also policymakers. Yeah, I'll leave it there. There's a lot of movement in the One Health space across the planet.
Yes, thank you, Dr. Thompson. For sure that we look forward to our collaborations in order to educate more of our students in high diploma in healthcare, as well as the young generations in the future about the One Health in order to make the better world altogether. Okay, so thank you very much, Dr. Thompson. Move on to the next presentation by Dr. Roy Rivera-Mazo. Professor Dr. Roy Rivera-Mazo is the head of the International Research Collaboration and Program Head of Master in Public Health at International Medical School, Management and Science University. He is also holding adjunct professorship positions at universities in the USA, South America, United Kingdom, and Asian countries. Dr. Roy is also the Vice President of International Association on Public Health, and he is one of the Fight Cancer Global's USA Executive Boards. Dr. Roy is an editorial board member in several international journals. His research focuses on epidemiology, health promotion, public policy, research methodology, communicable and non-communicable diseases, environmental health, nutrition, aging and quality of life, social and behavioral health, and healthcare management. The topic of today is the role of digital health literacy to public health during COVID-19. So welcome, Dr. Roy Rivera-Mazo.
Good morning, everyone, and thank you so much for the kind introduction. Digital communication technologies are playing an important role in the communication strategies of the governments and public health authorities during the COVID-19 pandemic. And as we all know, the internet and the social media have become an important sources of health-related information on COVID-19. However, the COVID-19 infodemic is spreading faster than the coronavirus itself, which jeopardizes the national public containment strategies. So welcome to the Academic Forum Series number 7 and learning about health and times on the pandemic. And I will discuss the role of digital health literacy to public health during COVID-19. This presentation is on the topic of digital health literacy during COVID-19 pandemic. And the purpose of having this discussion is to understand what is digital health literacy and how it affects to our community and also our society due to the digital divide. I will also touch some practical strategies and recommendations on how to improve digital health literacy. Digital infrastructure has been working to contribute each and every SDG, particularly the SDG number 3, which ensures healthy lives and promote well-being for all at all ages. And ICT, or information communication, telecommunication, plays a vital role in help to promote a patient-centered healthcare and improve quality of care, and also education of health, or to educate health professionals and patients. And because of COVID-19 pandemic, it threatens to reverse the progress of the SDG number 3. And as of today, April 13, 2022, there are 498 million cases of COVID-19 and 1.1 million COVID cases in Hong Kong, with 8,000 plus deaths. And during the pandemic crisis, 70 countries have halted childhood vaccination programs and also health services for cancer screening, family planning, or even non-COVID-19 infectious diseases have been neglected. And health literacy is very important for the prevention of COVID-19 transmission. And if you can see, the research in Japan shows that the health literacy is related to skills in evaluating information and also decision making. And such basic skills are important, particularly when an individuals encounter new health issues in which there is an insufficient evidence, especially during the first months of COVID-19 pandemic. Although comprehensive health literacy is necessary for COVID-19 preventive behaviors, the skills to evaluate a wide range of information and to make appropriate decisions are no less important. Since then, a flood of information accompanied COVID-19 pandemic. False news, conspiracy theories, or even magical cures were shared within the general public at an alarming rate. And this really may lead to an increased anxiety and stress levels. And the overwhelming information about the COVID-19 pandemic or infodemic often makes it difficult to separate what is true from fiction and rumor. And because of this, people may find it difficult or challenging to understand and utilize accurate information from many sources at the same time. And to deal such very complex health information, one needs health literacy to understand and assimilate and use health information and be able to communicate effectively with their care provider. Health literacy is defined as the degree to which individuals can obtain, process, and understand and communicate about health-related information needed to make informed health decisions. And digital health literacy is an extension of the health literacy, where the definition of health literacy is used in the context of technology. Thus, digital literacy is the ability to seek and understand and to appraise health information from electronic sources and apply the knowledge gained to preventing, addressing, or solving a health problem. But we have to remember that there are different types of hierarchy of digital health literacy. According to e-health literacy model, that the first level is a functional health literacy, where a person must have a foundation in basic reading and writing skills to be able to understand and use health information. Second is the interactive health literacy, which is the ability to interpret and apply information to changing circumstances. The third one is critical health literacy, which is the ability to analyze information or to exert greater control over one's life. And recently, another type of literacy involved in transactional model of eHealth Literacy 2018, and that is called translational eHealth literacy. It is the capacity for a person to turn the knowledge they gain from their interactions into a real life actions. And so translational literacy is the highest cognitive level of eHealth literacy, meaning it is informed and built upon from all lower levels of literacy dimensions. Unfortunately, not all can able to access technology. If you can pay attention to in this slide, the requirement to the access to healthcare and also the equitable access to technology are almost the same, and it must be available. The price of the technology must be affordable, and the people must be aware of the ways that the technology is relevant to their lives, and the technology must be accessible. And lastly, it must be appropriate user skills to translate technology access into a value development. And according to the International Telecommunication Union, people who have used internet surged to 4.9 billion in 2021 from 4.1 billion in 2019. And this unusually short increase in internet users is attributed at least partly to what's called COVID connectivity woes. This is due to a widespread lockdowns and school closures combined with people's need for access for news, government services, health updates, e-commerce, and online banking have driven the surge to internet usage, according to the organization. However, they estimate 37% of the world's population, or 2.9 billion people, are still offline. And it is very evident that there is a digital divide. And what is digital divide? It refers to a gap between demographics and regions that have access to modern information and communication technology, and those that don't have restricted access. And remember that there is a digital divide. If Norway, for example, in Norway, 96% of the population use the internet, while in Somalia, the percentage drops to only 2%. There is a digital divide because Yemen, it would take an average of 30 hours, 1 minute and 40 seconds to download a 5 GB movie. In Taiwan, it would take only 8 minutes. Digital divide is less problem in Hong Kong. Last year, 2021, Hong Kong ranked 32nd in terms of network readiness index. And Hong Kong is actually in a good position, but the bottom 5 countries were all came from the low-income countries like Angola, Ethiopia, Burundi, and Congo Democratic Republic. I think what Hong Kong really needs is to maintain the competitiveness. The government must be committed to strengthening the IT knowledge in the Hong Kong community as to facilitate the exploitation of opportunities in the digital world, as well as to ensure that the people in Hong Kong can readily make use of IT in their daily lives. An epidemiological study done in year 2020 regarding digital health literacy in Taiwan, and the study findings reveal that those who are at risk of misjudging health information had a lower educational level, lower income, and poorer health. And they are also rarely or never browse the internet. And another study published in Journal of Medicine Internet Research revealed that there was an association between socioeconomic disparities to e-health literacy and preventive behaviors in Hong Kong. Age was inversely associated with the e-health literacy score, while education and personal income were positively associated with the e-health literacy scores. It was also noted that those with the highest e-health literacy score displayed a high adherence to the practice of wearing surgical masks, washing hands, social distancing, compared to those with the lowest e-health literacy score. And another study done in Spain, published in BMC Public Health, revealed that the low health literacy is associated with a lower level of education, low socioeconomic status, and also physical limitation to perform everyday activities. Another study done in Malaysia last year, May 28, 2021, that was published in the International Journal of Public Health Research. Generally, the majority of the respondents had a sufficient health literacy when it comes to different domains like the healthcare, disease prevention, and health promotion. However, about 1/3 of the respondents have a very limited health literacy, and that is still quite high. It was also noted that among these domains, the limited health literacy group was most lowest in health promotions. And this is something that we really need to address. And this is a study done before COVID-19 pandemic in the year 2020. It was noted that the older adults in Hong Kong, 50.9% of the participants reported an inadequate health literacy, and also 25.5% showed problematic health literacy, and suggesting that the prevalence of a limited health literacy among older adults are quite high. Applying the information of the translational health literacy, it showed that the lowest health literacy index score, which is 63.9%, that means that the older adults from Hong Kong had definitely difficulty to turn the knowledge they gain from their interactions into a real life actions. And this can be due or could be a reason for some form of vaccine hesitancy to some citizens in Hong Kong. So it can be the reason, and it can be probably a good reason for a vaccine hesitancy. And with all these studies presented, can we say that a digital health literacy and internet connectivity can be acknowledged as a so-called social determinant of health? Why? Because they address all other social determinants of health, such as economic stability or sustainability, healthcare system, community and social context, education, and neighborhood and physical environments. And it also showed that digital health literacy is a stronger predictor of an individual's health status. So what are the effects of limited digital health literacy? Evidence shows that a limited health literacy is associated with more hospitalizations, greater use of emergency care, more hospitalization stays, lower acceptance of COVID-19 vaccine, poorer ability to demonstrate taking medications properly, and overall, it is a poorer health status and high mortality rates. So what are we going to do now to increase the digital health literacy? Remember that low literacy is more prevalent in some populations. Limited literacy is very can be seen across all the social demographic groups, and therefore a patient's health literacy should never be assumed. So Identifying the vulnerable individuals who are maybe at risk of a poor health literacy is the first step in bridging gaps. And who are this group of people? Those people are from the lower income groups in no education, and the older adults and those living in slum in rural areas, and those with chronic diseases and ethnic minority groups, and also those refugees and asylum seekers, and also with those having disabilities, and also those with no source of income, and people whose first language is not English. Again, identifying these vulnerable individuals is the first step in bridging the digital gaps in order that no one is left behind. Leave no one behind is the central transformative promise of the 2030 Sustainable Developmental Goals. And left no one behind not only entails reaching the poorest of the poor, but requires combating discrimination and rising inequalities within among the countries and also their root causes. So what are we going to do then? What other recommendations we need to do? We need to ensure that the people must have the access and skills to benefit from digital technologies in their lives, and also how are they going to apply in their lives. And also, in order to achieve a true digital adoption, people need to understand both of the functionality and also the benefits of the digital processes, and understand the role of the digital health literacy on the quality of life. So the World Health Organization included actually the digital health literacy among the components of the digital health ecosystem. And we need also to enhance other form of digital health ecosystem, such as the mobile health, telemedicine, big data, governance interventions. And because when we say digital healthcare ecosystem, it is an infrastructure that supports the transformation of the organization-centered healthcare model into a patient-centered model. And the main purpose of this system is to deliver multidisciplinary and collaborative health services. And this art in Germany initiated health literacy in schools. And I strongly believe that development of health literacy should be addressed from an early age onwards in order to empower children to develop their full health potential. I view that the schools can be as an ideal venue for strengthening health literacy because they reach almost all school-aged children throughout their school years. And integrating health literacy into schools when combined with existing curricula is a very good strategy. We should not only inculcate high level of knowledge, we should not only focusing on good skills, developing good skills, but most importantly, to teach the students to have a positive attitude to use information and information technology ethically and effectively as a responsible citizens and lifelong learners. Another good strategy is the Ophelia approach. Ophelia came from the word optimizing health literacy and access to health information and services. And it really seeks to improve health and equity by increasing the availability and also accessibility of the health information and services in locally appropriate ways. And what is good in Ophelia approach is this system supports the identification of community health literacy needs and testing and the potential of different solutions for addressing digital health literacy. Another one is the Health Literacy Questionnaire is a multidimensional tool that has been designed to provide practitioners, organizations, and government with and in the governments. And I can see that there are around more than 10 tools or questionnaires for health literacy. I think it's very important that we need to harmonize or standardize the questionnaire so we can able to do some comparative analysis per regions or per countries. I also observed that only few are doing qualitative research in digital literacy, and more qualitative research is encouraged so we can use it to gather more in-depth insights and generate new ideas regarding the digital health literacy. And if you notice the diagram in this slide, the focus of the digital research and service development are in the clinical care and self-care. However, most of the people spend much of their time in preventing illness and promoting health. It is therefore highly recommended to prioritize of digital health literacy research and service development that should relate to preventing illness and promoting health. And this slide expresses a common sense of scenario, a common scenario that we can see in the community or even in the clinics. Now, as public health specialists, we are constantly providing information to the community and we expect that the community must understand, remember, and act on that information that we're giving to them. And many of the patients or in the people in the community can feel like we're just reciting a textbook or procedure manual. I emphasize this slide because as a public health specialist, health education is very, very important for health literacy. And we need to go back to basics because we need to neglect the importance of health promotion. And in order to have a positive health outcome and reduce inequalities, we need to identify and acknowledge the social determinants of health. And we can include the digital literacy as a new social determinants of health. And once identified, we can do health promotion, okay? And also via health promotion via health education, and also experts can create healthy public policies that eventually improve the health literacy due to high level of knowledge, and that can able to lead the community empowerment. And according to the trans-theoretical model, that the people do not change behaviors quickly and decisively. Rather, change in behavior, especially habitual behavior, occurs continuously through a cyclical process. And this is a very critical point. Why did I say that? Because sometimes when we implement one program or an intervention, after 3 to 4 weeks of survey, we found out that there's no change in behavior. Since we don't meet our expectations, we simply say, oh, this is not a good or a not successful intervention. So what we're going to do, we change another strategies. But this is a wrong perception. When we want to change a behavior in the community, it takes time and you need to be very patient. That means that we need to have more stimulus to change the behavior, right? So this is the summary of my discussion for today. Both health literacy and digital health literacy have social origins, and the people with low health literacy are also likely to have a low digital skills, and that could lead to widening of the social divide. And the COVID shock has really increased the importance of digital health literacy. And over the past 2 years, the COVID-19 pandemic really increased our dependence on technology and accelerated the inevitable process of digital transformation as many aspects of life move to online already. Now, the shift towards the increased reliance on technology has caused recognizable social, economic, and political changes that will have a lasting impact, including our health. That's all. Thank you so much for listening, and I would like to invite questions.
Thank you, Dr. Mazel. It's really good presentation. I'm sure that all of us agree that the 5 A's, as mentioned in your presentation, is very important for the promotion of digital health literacy, in particular the elderly population, as well as the low-income group and the low education group. And also, it's a surprise that Hong Kong ranked 32nd of the network readiness. Hope that the situation will be improved further. So it's now open to the floor for the question and answer session. So I got one question. In Hong Kong, it is found that the network in rural areas is very weak, which affect the implementation and development of digital healthcare systems. Is it the same as in Malaysia? And is there any support from the government?
It is. Well, rural areas are, we can say that they are part of the vulnerable individuals in digital health literacy. As long as not everyone has the ability to connect to the internet and go online, which is accessibility. Of course, I just realized that Hong Kong also have a problem with access in the rural areas, but more so, in the third world countries and also the middle income countries. And I think it's not only on the, Dr. Winnie, it's not only on the accessibility to connect internet and to go online, but also the ability to use the internet and also the online services. And also if there's no confidence, because some people fear online crimes or maybe lack of trust or don't know where to start online, and also motivation, because if there's no motivation, it is quite very difficult to make themselves or to relate that the health literacy is very relevant and helpful to them. And it's not only with this, but also we need to see the design of how are we going to deliver the health literacy or health information, because not all digital services and products are accessible and also easy to use. And also regarding the staff capability and the capacity, not all health and healthcare staff have the skills and knowledge to recommend digital services and the products to patients and service users. And the government of Malaysia is very supportive when it comes to digital health literacy. There are different programs already, as I mentioned. We see that the health literacy in schools started in Germany. We are also starting now in Malaysia at the primary level. And I think this is a very good, very good opportunity or very a good move for the government. The government really need to create an excellent policies related to digital health.
Yes, thank you for your sharing, Dr. Martho. So thank you to all our honorable speakers for sharing with us their valuable experiences and insights. This is now the end of our academic forum. On behalf of Hong Kong Metropolitan University, thank you very much to you all for making time to be with us today. I wish you all a pleasant day and evening. Good day, good health, and goodbye. Thank you.
Thank you so much.